Okay. All right. Hi, everyone. Thank you so much for coming. We're going to start off this presentation by having all the presenters introduce themselves. My name is Ramya Kumar. My pronouns are she, her, and I'm the president of Northeastern University Global Health Initiative. And I'm just going to go counterclockwise on my screen. Next person is Cass.
Hi, I'm Cass. My pronouns are they, them, and I am in the BU Pure Health Exchange chapter, and I've also been a sexual educator for 3 years.
Thank you. Anissa?
Hi everyone, my name is Anissa. I am in the Pure Health Exchange chapter at Northeastern, and I'm also the former secretary of NUGHI, and my pronouns are she, her, hers.
Thank you. Raina?
Hello, everyone. My name is Raina. My pronouns are she, hers, and I'm at Northeastern Pure Health Exchange.
Awesome. Lily?
Hi, I'm Lily. My pronouns are she, her, and I'm a member of NUGHI.
Thank you. And Elif?
Hi, I'm Elif. My pronouns are she, hers, and I'm a member of NUGHI and Pure Health Exchange.
Awesome. So I will go ahead and share my screen to start this presentation. Yeah, so as I mentioned earlier, so the purpose of this presentation is to inform everybody about the ways that you can practice safer sex in the pandemic to prevent transmission of STIs, HIV, as well as prevent the spread of COVID-19. And the information and the demonstration tools presented in this video provided by ABCD Health Services. What is ABCD Health Services? For those of you who are not familiar, ABCD Health Services works to ensure that young people's rights to information, health education, wellness, and care are accessible in our community to support their overall well-being. And they have a variety of programs that we will elaborate on later on in the presentation that serve communities of color in Boston, Mattapan, Roxbury, Dorchester, and Chelsea. They create safe spaces that are sex positive, center the needs of youth and young adults in our community, non-judgmental, gender inclusive, culturally relevant, and trauma-informed and healing.
So the symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, a headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. It is important to note that these symptoms can occur individually or together. There is also an incubation period, which means that you can start showing symptoms up to 14 days after actually catching the virus. You may not know that you are infected immediately. It is very important to remember that these symptoms differ significantly from person to person. Some people may show no symptoms at all, and lack of symptoms does not stop transmission of the virus. So how does one person actually get COVID? You can contract COVID-19 if you come in contact with another person infected with the virus, or someone infected coughs or sneezes directly towards or on you, or you can touch any surface with little droplets from infected people's coughs or sneezes and then touch your eyes, nose, or mouth. Because of how COVID-19 spreads, because it requires close contact, sex is a risky activity. And if you're close enough to touch an infected person, you are close enough to get the virus. This includes activities such as hugging, kissing, talking face-to-face, holding hands, and any other close contact activity. Also, there is still a lot that we do not know about COVID-19 and sex. While studies of infected individuals have shown that COVID-19 was found in semen and stool, we still don't know if it can spread through intercourse itself.
So I'll be talking about how to stay sexually safe during COVID-19. So to start off, you guys might be wondering, how do you prevent the spread of COVID-19 during sex? The first tip that we have is just remember that the safest sex to have is with yourself. So masturbation won't spread COVID-19. And the one tip we have for that is to make sure that you wash your sex toys and your hands before and after engaging in solo sex. And if you are to engage in sex with another partner, it's recommended that the person be in your small circle, whether that's someone that lives with you or is in your quarantine circle. However, if you do engage in sex with people outside of your house, just be sure that if possible, it's as few partners as possible, and just to pick people that you find to be trustworthy. And that leads to what I think is the most important point, which is that it's just really important to maintain an open dialogue with any of your sexual partners, not just about COVID-19, but also just about safe sex in general. So whether that's how often you feel comfortable being tested for COVID or being tested for STIs and HIV, as well as what form of safe sex you guys want to practice. So how do you make sure that the sex you have is safe? The first tip we have is condoms. So condoms are a great way to prevent the spread of COVID-19, but they're also a great way to protect against STIs and HIV in general. And if condoms aren't applicable to the type of sex that you're having, you can also use dental dams as well during oral sex. And another tip would just be to bring a face covering and hand sanitizer, and make sure to clean your hands both before and after to prevent the spread of COVID-19. And then the last tip, which is understandably difficult, but it is to avoid kissing if possible, because that is the highest risk activity in terms of sex for getting COVID.
So ABCD Health Services offers a variety of incredible programs to prevent the spread of STIs that are ongoing during the pandemic. So the first one is the 3 Steps in 30 Days Challenge. And this program results in a individualized personal protection plan from HIV and STIs. So the first step is a variety of sexual health education programs that are provided for free by ABCD Health Services that allow participants to gain sexual health knowledge and skills. And the second one is an individualized personal protection plan created by a sexual health advisor. And the third step is knowing your HIV and STI status through free testing provided by ABCD Health Services. Another program is a social media HIV and AIDS prevention campaign, and it also is a reproductive health education social media campaign titled Safer is Sexy. Sexy stands for Sophisticated, Empowered, Extraordinary You. And this program is on Facebook, Instagram, Twitter, and you can also reach them through email at all of the handles provided on the screen. And also using the website in the lower right-hand corner of the screen, you can sign up to receive a free pandemic safe sex kit from ABCD Health Services. And this kit comes with surgical masks, different types of condoms, hand sanitizer, and antibacterial hand soap. And 2 other programs that ABCD Health Services provides are Sister to Sister and Boss Up. And these are both for people young adults in Boston between the ages of 15 and 25. Sister to Sister provides personalized STI, HIV prevention plans and sexual health information sessions for young adult women identifying Boston residents delivered by health experts. And these plans and sessions with the sexual health experts are judgment-free and completely confidential. And by completing this program, you receive a $30 gift card and a safe sex kit. You also receive a safe sex kit after completing Boss Up, and Boss Up involves 60 to 90 minute one-on-one conversations about sexual health, relationships, and overall wellness for young men in Boston, again, between the ages of 15 and 25. And by completing this program, you receive an individual risk assessment for HIV and STIs. And now Cass will demonstrate the different safer sex tools that are found in the kits that you receive for free after completing Sister to Sister and #BossUp. So I will stop sharing my screen. And Cass, go ahead.
Awesome. So this is the kit that you receive once you complete the programs, and it comes with this little packet, which includes a bunch of different sorts of condoms, sexual protection, even including latex-free condoms for people who are allergic to latex. And in this package, we have different sorts of protection. We have the internal condom. We have a dental dam, which, as we mentioned, is for oral sex, for genital to genital sex, if it's 2 partners with vulvas, or any other sort of use that a dental dam can be used for. The external condom and lube, which is very important. So we'll start with the first demonstration with the external condom. And you start by ripping it, making sure to not rip the actual condom, and be careful because there's lube in there. Once you remove the condom, you're gonna see that there's the tip of the condom, and you're gonna wanna make sure that it is outside the ring, right? So then we see the ring coming, and we're gonna wanna pull it over the head, giving some space, and then we're gonna wanna pull it down over the condom. Oh wait, oh no, I did it the opposite way. 1 second. Can I redo it again? Would they edit it?
Yeah, go ahead, start over.
Oh no. All right. So you're gonna take one condom, open it up. Making sure not to rip the condom inside. And you're gonna make sure that the tip of the condom is out and the ring of the condom is outside of it so you can easily roll it down. So you're gonna put it over the head of the penis and then just easily roll it down. And make sure you get all the way to the base and make sure it's secure. There's space at the top for any semen, any ejaculate, and then it fits snug, but not too tight, because if the condom is too tight, then it can rip or fracture during sex. So this is the external condom. Now with the internal condom, you open it up. And then you see this much larger version of the external condom. And you see there's the opening right here, and then this flexible disc. So you're gonna squeeze the flexible disc, and you're gonna pop it in to the vaginal canal. Pop it in just like this. And then you're gonna make sure it's secure right to the end of the base. Making sure that the ring is around the cervix. It's a little bit difficult to see. And then making sure that this external ring wraps around. So you can see it all the way around the labia. And when a penis is inserted or a toy or anything is inserted, make sure that it doesn't take the internal condom out, and make sure you can still see it around all the labia. And with dental dam, this can be used for genital contact, and just make sure that it's covering all of any body fluids that are there. And this comes with instructional kits on how to use an external condom or instructional kits on how to use an internal condom, both in Spanish and English.
Thank you so much for that demonstration, Cass. So I will start sharing my screen again. And Anissa, go ahead.
Yeah, thank you so much, Cass. That was really great. So now we're going to talk about just a recap on advice on safe sex during the COVID-19 pandemic. So the first point is you are your safest sex partner, which we've talked about before. The next safest sex partner is someone you live with, whether that's a roommate, a spouse, or your partner. Having close contact, including sex, with a small circle of people will definitely help prevent the spread of COVID-19. However, one should only have sex with consenting partners. And again, you should limit close contact, including sex, with anyone outside of your household. And if you are going to have sex with people who are outside of your social circle in your household, you should talk regularly about COVID-19 risk factors, just as you would discuss PrEP, condoms, or any other safe sex topics. Ask them about COVID-19 before you hook up. Next, you want to talk about questions that you can ask before you hook up. So you definitely want to know, like, if they have had flu-like or coronavirus symptoms in the past 14 days. This could be like fever, cough, sore throat, shortness of breath. These are all symptoms to ask about for assessing for coronavirus. And note that asking about these symptoms is not a really perfect way to assess whether someone has had COVID-19, because you can be asymptomatic for the virus. And then you want to ask, have they encountered anyone who has had coronavirus in the past 14 days? Because if they have, then they've been exposed and they could potentially expose you, which would not be good. And lastly, you want to know what was the last date of your most recent COVID-19 nasal swab or saliva test. And at Northeastern and BU, students are extremely fortunate to get COVID-19 tested at a pretty regular basis. However, not all schools and universities have a COVID-19 protocol in place. The last point that I just want to make is that if 2 is a company, then 3 or more is definitely a crowd. Large gatherings, especially during the COVID-19 pandemic, should be strongly discouraged. They're not safe, and close contact with multiple people should be avoided. However, if you do decide to hook up or have sex outside of your circle of contacts, you definitely want to closely monitor yourself for symptoms and get regularly tested on a more frequent basis than usual. I would say if you're hooking up with different people and different partners, you want to get tested at least monthly, if not like 5 to 7 days after you hook up with someone. And you want to take precautions when you're working with or encountering people who are at high risk for coronavirus. So this would be people who are 65 years or older, or anyone who has a serious medical condition. And then lastly, mask up. Be very vigilant about wearing face coverings and also practicing healthy hand hygiene to prevent the spread.
Awesome. Thank you, Anissa. So just to wrap everything up, COVID-19 is an infectious disease, but one thing that we have is the power to fight it. And so the ways we can do that are by practicing social distancing, wearing a mask, and washing your hands as often as possible. You should always be practicing safe sex, but especially during a pandemic, knowing how we know how it's transmitted. So always communicate openly about symptoms, wear a condom, and remember that you are your safest sex partner. ABCD Health Services provides resources to help you make safer decisions. So they provide free and low-cost resources to help you make the right decisions for you. And if you're wondering what to do next with all this great information, make sure to visit ABCD Health Services for safe spaces with services ranging from mentoring to STI testing. You can apply for a free Safer Sex Kit right there at that link with all the great things that Cash showed us earlier. You can take the 3 Steps in 30 Days challenge to begin your journey to safer sex, lots of information on there. And you can also follow Safer is Sexy on their social media accounts, lots of awesome information and sex positive content there.
All right, thank you to everyone who watched this presentation, and thank you so much to our amazing presenters. Awesome.